Great. Okay, so I'm Michelle Vogel. I work for SiSi Pharmacy, and welcome to health insurance. And I changed the topic. So instead of navigating health insurance, I decided to change it to friend or foe for myositis, because I'm going to try to lighten this up a little bit so it's not going to put you to sleep. Okay, so let's start out about a little bit about me. So my personal mission has been to ensure that all patients get access to the providers they choose, and choice is going to be a big theme throughout this meeting, to the brands of therapies that work best for them and the best site of care. I've worked with the myositis community since 2007. This is my 8th conference. I specialize in patient advocacy, navigating health insurance. I actually love doing Medicare and Medicaid reimbursement, if you believe that. I like doing health insurance policy, and I'll be talking about changes in policy coming up and disability reform. And my expertise in patient access issues, specialty therapies, and I have worked with immunoglobulin therapy since 2003. And I joined in 2016 SiSi Pharmacy as Vice President of Patient Advocacy and Provider Relations. So who is SiSi Pharmacy? We're a nationwide specialty pharmacy dedicated to servicing patients with chronic and rare illnesses requiring complex care. We're invested in improving the health and lives of the people we serve by offering expert clinicians, passionate advocates, and committed healthcare partners with strategic reimbursement experts. Our goal is to optimize patient outcomes while treating patients, and this is important, as if they're members of our family, and we truly believe that, and you'll see that as we talk about it. We want to make sure every patient is treated as if they are a member of our family, and we want to make sure patients aren't treated like numbers. And if you're being treated like a number with a provider, we're going to talk about that. You should never feel like that. So, with the myositis community, we treat dermatomyositis patients, poly, necrotizing myopathy. We have some inclusion body myositis patients. Juvenile myositis patients. 20% of our patients are myositis patients. We love this community, and we're invested in it. So my goal today, teach you healthcare terms that don't scare you. Teach you about your rights, and that's really important. Help you choose the right health insurance plan. Make sure that you know that when you're renewing your health insurance plan, it may change. So don't always assume that's the same. Teach you how to navigate your current healthcare plan. Always remember that you should be treated with respect, not as a number. Choose providers who will partner with in your care, because it's a long journey. I know. I also have autoimmune disease, and I've actually fired a doctor, and you can fire your doctor. Okay, so you need to find the right one that will work with you. By the time we finish, I want you to feel that no insurance company is too big to conquer. Most importantly, you're not alone in this fight. You have me, and I will help you. Okay, you do not have to be a patient of SiSi. I'm here, committed to the myositis community to help you. And you could reach out to me at any time, and I will be there with you as your advocate. So, type of health insurance plans. How many people in this here today have Medicare? Raise your hand. Okay, of those people, keep your hands up if you have traditional Medicare. Okay, keep your hands up if you have Medicare Advantage plan. Okay, we're going to talk about changes in Medicare Advantage plans too. Medicaid. Anybody have Medicaid? Okay. Anybody VA? Okay. TRICARE. Any TRICARE patients? Federal Employees Health Benefit Program. Anybody? Employer-sponsored plans. Okay. Remember, every year, do you have choice of plans within your employer-sponsored plans? Okay. Healthcare market plans. Anybody in the healthcare marketplace? The Affordable Care Act? No. Okay. Anybody in healthcare sharing plans right now? Faith-based plans? Okay. Other individual plans, meaning you may be, okay, you have it, how about self-funded plans? Okay, gotcha. Okay, how does insurance make you feel? I know that some of these emojis may describe when you're working with your insurance company that you just want to explode because they're just calling 1-800 numbers and not getting anywhere and getting frustrated. So what's in store for healthcare? I'm going to call this the perfect storm right now. We're having elimination of patient choice, increased cost of insurance and drugs, destabilization of the Affordable Care Act, and we have new Trump healthcare plans. So what does that mean? Complex health problems, destabilization of the Affordable Care Act, driving up costs of health insurance plans in the marketplace, introduction of cheap health plans with no protections of the most vulnerable populations, needing the most effective and expensive therapies, equaling the perfect storm. So what are the current threats that I'm going to go through? I'm going to go through the changes in the Affordable Care Act, Trump plans, healthcare sharing plans, understanding Medicare, the prior authorization process, and patient choice. So here we go. Affordable Care Act, Preexisting Conditions. This is the biggest and most important issue for everybody here. In the Affordable Care Act, we protected making sure that no insurance policy would stop covering us for pre-existing conditions. Okay? Now, with the pre-existing condition, there's a lawsuit going on in the state of Texas. We have to watch it because if it cuts down on the Affordable Care Act, we may see that pre-existing conditions may no longer be protected. What that means, as long as you stay insured, you're okay. If you lose your health insurance, you may not be protected. Okay?
Could you describe, tell us what the last sentence in the first bullet means?
Protections will be expanded to all health insurance policies. Oh, the first one or the second bullet?
In the first bullet, last sentence.
It says protections will be expanded to all health insurance policies, so it eliminated all pre-existing conditions. Now I'm going to explain that when we go to Trump health plans.
What would that be called a protection?
So under the Affordable Care Act, before the Affordable Care Act came into place, we were, health insurance companies were allowed to provide.
But we have ACA now.
Okay.
So this says it will be expanded.
Okay, so it was expanded. Now we have plans, so that needs to be, it was expanded. Mm-hmm. Now we have lawsuits in place that may eliminate that expansion, that protection.
Right, but then we won't have the protection.
We won't have the protection, so that should be fixed, okay? Okay. Out-of-pocket costs and deductibles. Limits were placed on the amount of insurance companies can require policyholders to pay in out-of-pocket expenses and copays and deductibles. That's all changing. That's not in place anymore. Individual mandate, that was eliminated. Okay? With that,
well, and they can still have it. They still can do it, but they don't have to pay.
No, again, you don't have to be, you do not have to have health insurance anymore. By doing that, you don't have all the people in the pool anymore, which is driving up the cost. Okay? Now, continuing, we did eliminate lifetime and annual caps. We eliminated the rescission so insurance providers no longer could drop individuals when they became sick. That was a big problem. And the donut hole rebate, it started the whole 50% discount. And actually, if everything goes forward, we're going to see that close in 2019 instead of 2020. We're just waiting to see if that's going to go forward. So that may actually be fantastic. Now, Trump plans. These are short-term plans, but they can last longer than that, and they're in the States. So these exclude coverage for pre-existing conditions. They are intended for people who are between jobs or need temporary coverage. There's nothing that would prevent companies from underwriting, issuing new policies to individuals at the end of 1-year coverage term. These are 2 policies that came out. United Health Group doesn't cover prescription drug coverage, normal pregnancy, treatment of mental disorders. National General doesn't cover outpatient prescription drugs, normal pregnancy or childbirth, routine low baby care, costs resulting from pre-existing conditions. So this is the trend that we're going to start seeing. Healthcare sharing plans. I put this up here because this is a major concern, and I'm hearing more and more patients who are on these plans, and all of a sudden they need IVIG, and I get a call and say, why isn't my insurance covering this? Faith-based programs, they sound fantastic. $300 to $500 per month for family. I mean, it sounds affordable, but what happens is it doesn't cover prescription drug policies. So if you have ongoing expensive prescriptions, it'll cover it for a short duration. Maintenance drugs are not covered at all, and they send you to these needy meds, Good RX, 1RX, and Lowest Med, and you know that they don't cover these drugs for us. So, and even if you look at the exceptions, I love this, cancer and transplant recipients may be covered for only 6 months. Type 1 diabetes would cover insulin for a very short duration. I mean, and if you had, say, a heart attack, it would cover the heart attack, but it wouldn't cover the drugs. So do not go into one of these plans. So I had to put a little humor in here to wake you up. I want to take your blood pressure, so try thinking about health insurance premiums. Okay, let's get into Medicare. Traditional Medicare. Part A is for your hospital. Part B, your physician outpatient. People, if you're getting your infusible drugs, your Rituxan has to be done in an infusion center, in your physician office, or the hospital. That's under your Part B, okay? Your IVIG would be covered under Part B in the physician office, the outpatient. It's going to be covered in Part D in the home care setting. Medicare Part D, IVIG is covered, and then starting, there are plans, and there's more plans coming out starting next year to help cover the donut hole. And for low-income people, especially people on disability and other things, there are more plans, and you can contact me, and I'm more than happy to go over it with you to help with co-pays, donut hole assistance, and other things. So there's more and more plans coming out for next year. Supplemental plans. People, this is really, really important. If you're going on disability, you have one shot at this. When you go on it, you have to choose your supplemental plan at that time. If you turn it down, you don't have another option until you turn 65. Okay? And it's expensive, and I'm hearing more and more patients saying that their supplemental plans are going up during a plan year. So they may get, their coupon book shows that it's going up during the plan year, twice or 3 times during the plan year. So I'm going to be looking at the rates and seeing what other options there are for supplemental. So if you're seeing that problem and it's becoming unaffordable, let me know, because I'll be investigating that. Okay, also, if you don't sign up for a Medigap policy immediately, pre-existing conditions may apply. Medicare Advantage plans. We had one person who has a Medicare Advantage plan? Three. Okay. Changes are happening with Medicare Advantage. They are going to be limiting the number of specialists in the pool. They're also going to be cutting down on specialty drugs. So be aware. Also, if you have to go out of state to see a specialist, they're going to try to make you see every specialist within the state before you can go out of state. These are new rules coming out. So it's being harder and harder on the Advantage plans. I know that's more cost effective, but it's limiting choice.
Do you have a timeline on that?
Next year. So again, you're looking at your options. Yes?
What are the two plans that are going to reach the Supreme Court out of those 12 cases that are waiting? What are those going to be? I understood one of them was to limit all existing conditions.
That's right now in Texas. We have to wait till the Texas verdict comes out before that even goes to the Supreme Court. Okay, so and then you're going to have more step therapy going on in your Medicare Advantage plans as well. So this is a, oh sorry.
Question. Step therapy means.
Okay, so step therapy means that they may have you go through another drug before you go. So
Okay,
it's like steroids or something else before you would get approved for some other drug.
Right. Got
So
it.
this is understanding your Medicare gap, and this is where it goes through your initial paying, and you have to pay a certain amount. Your responsibility, and then you go through your coverage gap. The great thing is that we're going to be closing that coverage gap up, and then you have your catastrophic where you hit the 95%. One of the things that I want you guys to know is that people who are doing home infusion, anybody who's on IVIG here, who's doing it in the home? Anybody? Who's doing it in the hospital or physician office? Okay. Do you have secondary, or are you getting covered 100%?
Well, so she just got on Medicare 1st of August, so we were covered under our other insurance, so now Medicare has become the primary, so we haven't billed through them, so I don't know.
Okay. So does she have coverage? Does she have a supplemental plan as well?
Yes.
Okay, good. So she'll be covered at 100%. If you do go into the home care setting and you shop around, ask them for assistance plans, okay, to help you with your coverage gap. Shop around because there's plenty of home infusion specialty pharmacies that will have assistant programs for you. There's competition out there,
Right.
okay? And so you
But
ask.
it continues in the hospital.
You can do it in the hospital. Again, this is about choice, and I love that. You have choices in the hospital, you have it in the physician infusion suites, and you have it in the home. Whatever works best for you is what's great,
Right.
okay? Now, Medicare Part D prescription plans, you have a lot of different plans out there, and understanding of different plans. If you are confused on choosing a plan, you can contact me and I'm more than happy to help you. Okay? We have a program that we can put in all of your medications and it'll come out with what the most cost-effective plans are. And I'm more than happy to do that as free of service and help you go through and choose which are the best plans for you, because it gets very confusing on what to choose, and if you're trying to make a decision if you should switch plans for the next year, more than happy to offer that help. Okay, my favorite topic, prior authorization. Did you get your prior authorization before you became ill? Always get your prior authorization. So what is prior authorization? Pre-certification, the fun term. It's an extra step that most insurance companies require before they decide if they're going to pay for expensive specialists, procedures, and specialty therapies or medications. During the process, the insurer may request and review medical records, test results, and other information so they make informed decisions. So again, we were talking about self-insured plans and they're asking for everything. They can ask for everything. Unfortunately, they can, at any step of the game, they can ask for it. Determine if the service will be deemed medically necessary and identified as a covered service under your insurance policy based on what information was submitted. So you have to get it right the first time. So some of these cases, and I know we've done where it may be an inclusion body myositis patient who has dysphagia, and it may help with the swallowing, but it may be considered kind of experimental. We'll put articles together and submit it and request for a 6-month trial. But you've got to submit the articles, you've got to submit all of the records and request it. If you don't, and if you look at what the criteria is for insurance, just looking at it and making sure, do we have your EMG results? Do we have your MRI results? Do we have all of that? Just doing your regular for DM or polymyositis or necrotizing myopathy. If we don't have that and we don't submit it correctly, you will get denied. So if we're not doing the job right, you'll get denied and you'll end up in an appeals process, and that's not right. And we hate appeals. So we've got to do it.
Who do you work for?
I work for SiSi Pharmacy, but I will help you. Okay? If you're having trouble and you're in an appeal situation, I'm more than happy to help you, because I hate when people are getting denied their therapies or anything else that they need. Yes?
That appeals process is a joke, because they say you have the right to appeal, but when you do it, that doesn't mean they have the right to, allow you to have the appeal. It's just a big joke. I've done that with myself, and went to the highest level. I ended up writing to the director, or whoever was in charge of it, and I got a letter back from him, and I thought it was not really. It wasn't helpful at all. I mean, this was something not really. It was something I was doing on my own, but I'm telling you, they always send me this letter saying they're going to appeal, but it's a joke.
So again, you have to understand what the guidelines are for the insurance company, and you have to address those guidelines with your appeal.
And you talk about articles. I sent articles.
So,
I had all my records.
okay, so sometimes, okay, so the other way sometimes I say is bring in a political influence. So I sometimes bring in a member of Congress.
That's what I was thinking.
Yes. So we can talk about that and see what help we can get. So usually a doctor or pharmacist will be notified in writing by phone, receiving a letter. If you're denied, you will get it. But I say you must appeal, because most times you will win an appeal, but there are times when you won't win an appeal. Sometimes you've got to be creative. And I learned early on in my vocabulary the word no doesn't exist. And you just got to beat up on them. And it's hard, especially when you're a patient and you're not feeling well and everything's coming at you. And sometimes you need an advocate to help you. So I'm more than happy to help you. But one thing I want to stress to you, when you're getting these expensive therapies, or you're going for MRIs, or you're having procedures, make sure if you need a prior authorization, get it, because I don't want you stuck with a bill. Okay? That would be the worst thing. Now I'm going to go into my favorite topic right now, and that's patient choice that we're losing. Have you been forced to change providers, pharmacy, labs, told that you have to go somewhere? Yeah, we're all being told that. Have you been told that you can no longer receive a brand of therapy you were getting? may be forced to a generic, may be forced to another brand. Have you ever been told you can no longer receive the care you've been receiving from the specialist you like or the home care provider you've been with? We've got a major problem with the elimination of patient choice. So in the pharmacy spectrum, and I'm going to just touch upon this, we've got what we call pharmacy benefit managers, and that's our biggies. We've got CVS Caremark. You may know them from your mail order prescriptions. Your CVS Caremark, Express Scripts, Optum RX, Prime Therapeutics. Some of these may ring a bell with you. Walgreens, Walmart Pharmacy. Okay? Right now, you've got insurance companies and PBMs acquiring each other.
I went through Nord and I got RX Outreach, so I'm not sure that's not appearing on any of you.
No, you're okay.
Okay.
Okay?
What was her pay statement?
It was through Nord, which is the National Organization for Rare Diseases.
And they put
That's
me in
okay.
touch with RX
That's okay.
Outreach.
That's fine. But this is what concerns me. When you have insurance companies acquiring pharmacies like this, and where your records are going, and who owns what, you're not having, patient choice is going out the door. So this, and where antitrust is going in all of this. It's like somebody is asleep at the wheel. So where is the future in all of this? So my humor, please pray for my health insurance coverage too, Father. Okay? Patients have to be their own advocates. I mean, nobody can advocate better than you can. You have your story, you have to tell it, you have to be strong about it. Patients need to be knowledgeable of what's in their health insurance plan, how to choose the right health plan that meets for their needs. When you have choice, sometimes we just don't have choice. And we've got to do the best what we have. But when we do have policies, we've got to look at what's in those policies. And I know it can be intimidating. So if you need someone to help you look through the policy, I actually enjoy reading health insurance policies, and I'm more than happy to look at it and see what's in there to help you understand it and know what's good and what's bad. I know that sounds crazy, but I guess it's my hobby, and I'm more than happy to help you with that.
So it's your superpower.
My superpower. Open season's coming up, so don't assume that your plan is absolutely the same as last year. We've got to read them. And employer-based plans, okay? This is also a new trend. They're carving out the prescription drug plan. So make sure you know it. If you're with a provider that you like, you may not have it anymore. If you're in the home, you may not have that home care provider anymore because it may be with another prescription plan. So we have to know if that's happening.
When you say they're carving it out, do you mean they're doing away with it? Or
No,
what do you
it
mean?
will still be there, but it may be a new drug card that you'll see coming in. A different company. So if you're with a home care, so say you get your therapy in the home and you have a nurse you like, and all of a sudden you think you're just going to be getting that next infusion, and all of a sudden you find out, oh no, I can't get it done anymore in the home with that same company. It's a little shakeup. So we just need to know what those changes are, and if you have choices between plans, then you know that that's happening. Okay? There are more high deductible plans that are being introduced, and I know that you guys are seeing that more and more. So understanding those high deductible plans, understanding co-insurance and the co-pays and what that means overall, and how you can afford it, and just being able to figure out managing that. Okay? I think that once we start seeing hopefully more drugs coming in and getting on label, then we'll see assistant programs, and that will help tremendously for this community. But until then, we've got to figure out how we can help that. The state plans, as I showed you earlier, they're gonna have less protections for us. And that's gonna be the biggest scare, and then seeing what happens with that lawsuit in Texas, and then moves forward, what that means for pre-existing conditions and all those protections for us. And then the Medicare Advantage equaling less choice, which is, I mean, really concerning because it is the more affordable choice, but do we have access to everything we need within those plans? So, I'm here for questions from anybody. Yes.
My doctor had said that he would write, as a board of directors, part of the board of directors, would write a statement as to why I needed IVIG as opposed to any of the other drugs that had already been tried, and submit that with my insurance claim. Do you feel that that's helpful or not?
It is.
Okay.
That is.
So that's another way to go.
Mm-hmm. And he'll...
Anything else?
Well, so in your records, he'll show that you've been on all the other drugs.
Yes.
And so that will be in your history.
Yes.
So it'll show that you failed on those other drugs and that you need to go on that. And that's perfect.
Yes. Correct. Okay. Good.
Yes, sir.
So how do you deal with a situation where your doctor's with you, giving you your options, and that same doctor says, it's out of my control. Basically, the insurance companies are, saying what the options are going to be, or the order in which you take them. How do you address that?
So,
Because that's what happens.
so part of the problem is that doctors aren't paid to spend time doing the insurance. So they're not going to spend all that time working on that. So it's a hard thing. And it takes a lot of time. I mean, if you get a denial, and I have to say, a lot of the time, if they don't submit it correctly, you're going to get denied. And then they have to go through peer-to-peer, and some doctors just won't spend the time doing the peer-to-peer calls, and then you're going to get denied, and you're going to be right in the appeals process, because sometimes we won't even end up in appeals if you do the peer-to-peer call. But some doctors won't even do the peer-to-peer call.
Some doctors won't even go to those options that their conscience is telling them that this is what I'd like to try, what I should try, but I know through my patients that this is not going to work through insurance. So they're more influenced by what the insurance is designating than what they are,
So,
medical, solution.
So if your doctor's not willing to do what options there are for your disease, then you shop around for another doctor.
But isn't it true that the insurance companies are really putting a lot of pressure on the doctors to what they can and can't do?
They can and can't do, yes, but there are treatments, and there are doctors willing to go the bat and fight for you to get certain treatments. And again, if your doctor's not willing to, but will be willing to get some assistance to help you fight with the insurance company, I'm more than happy to work with your doctor to help him. Yes, sir.
What is the peer-to-peer process?
So what happens is, once you go through and we submit, say, for your submission for your claim, and they're not ready to approve you, and they have questions, before they deny it, they'll ask for a peer-to-peer, and they'll want your doctor to speak to their insurance doctor. And they do a call, and they go over your record to see if they will approve it before they actually do an official denial. Yes, sir.
Yeah, I've been taking Rituxan once a year. It's been covered by plans from my employer. I'll be going on Medicare in a couple of years. Has Medicare been very good about covering Rituxan, like for Rituxan?
What state do you live in?
Kansas.
Kansas should be okay. The only state that it doesn't cover it is Florida. Because you have in Medicare, you have what's called local coverage determinations. And in Florida, there's a local coverage determination not covering it for myositis. It has specifically listing what disease it will cover. It does include myositis. So we have to have some doctors work on getting myositis included in that. I can look up and see if Kansas lists it. So I'm more than happy to look that up for you and see if that would be taken care of.
Is the basic Medicare, you cover that, or what your supplemental plan?
So if you do that, you're gonna wanna have a supplemental because you don't wanna have to pay 20% copay on that drug, okay?
Let me get that straight. Florida excludes myositis from coverage via.
There are a number of diseases. They have a list of diseases that will cover Rituxan under Medicare. It's under a local coverage determination. Nobody has worked hard to get, you have to work with the Florida state to get these diseases in. We've got to work to get.
But only for that drug.
For that drug.
Not for myositis in general.
No, no,
Okay.
just for Rituxan.
Okay.
Oh, where was I go? Oh, yes,
Sorry.
yes.
Is there any limit on what insurance companies can deny things? I had a pap smear denied because they wanted a statement from the lab that the procedure was medically necessary.
From the lab.
Yes, to which we're still in the process with this. I called my gynecologist office and they said, we've never heard of such a crazy thing. So they were going to send them the doctor's notes again and say, this is a pap smear, you know, normal standard of care for healthy women.
No, it's not.
No, it wouldn't come from a lab. It would come from,
The
but
doctor.
also, yeah.
They wanted
and
it from the lab.
no, that doesn't make sense.
Yeah,
And
okay.
also,
So can't
your
they
ins-
just keep making me jump through these hoops?
no, and we can also look and see if the insurance has guidelines that we can pull down, and we can cite those guidelines, because I've done that with my own insurance when I needed an iron infusion, and they cited that it was against their rules, and I pulled up I pulled the state laws and used it against them, and they had to cover it. So we can look at that and see what we do with them.
Hopefully, what the doctor's office sent back to them, basically saying, this is crazy, we'll take care of it. But it's not a huge expense, but with all the other copays and stuff, not having that lab test covered is, about $150.
We can also see if your insurance has case managers and see if we can get a case manager assigned to you. Okay? So that's also something we can do.
Why aren't we assigned case managers?
You have to request that
Who
okay.
do you request that from?
from the insurance company.
Okay. Thank you.
I saw you. Yes.
Ma'am, my wife is in a similar situation with a gentleman. I just recently retired, so we moved from employer healthcare to Medicare. So will Medicare continue to cover Rituxan infusions for myositis?
What state are you in?
Georgia?
Georgia is, yes, but double check with me and I will look it up. I do not see an exclusion in Georgia. So, and I looked that up 2 years ago, so let me double check on that and make sure that's okay.
Okay.
Yes.
So one of the issues we're having is, he doesn't have a clear diagnosis. We're somewhere in the myositis family thing. So that, as far as any sort of treatment, they're kind of walking it on, they're like, well, what's your diagnosis? And we keep saying, we don't know. We don't know exactly what it is. And we're getting kind of different diagnoses from 3 different doctors. So that's one part of our big issue. And then the other part is our doctor's office. We're trying to get IVFG, and if the doctor's office keeps filling the paperwork out wrong, they're putting random diagnoses down because they don't know exactly what, and they pass it off to the infusion company to do versus the doctor's office. So like, they don't even, I think the communication between those two is terrible. So, I mean, we literally have been.
So that's very important that we get the coding right and the diagnostic codes right, so
They
there's
won't
not
tell me.
confusion.
When I call the insurance company, they're like, we can't tell you over the phone what the diagnosis is.
But you should be able to communicate with even your infusion company.
I don't
Okay,
to work out.
let's talk about that, and we're gonna get you, because you have the right to know what your diagnostic codes are and what everything.
Yeah.
So you have a right to have your patient records, so yes.
Which I have a lot of.
Okay, so we can work through that and get that straightened out, because that's really important when you're getting your treatment.
Does your diagnostic code automatically transfer to your SSI code?
So it depends. So when you're going for disability, it depends on what they go for your disability. So it depends on so you may have many different diagnoses.
We have one.
You have one.
Yeah.
So then they will apply that under, so myositis is one of, you can go for myositis for disability.
They did not do that.
They did not.
Nope.
There is a diagnosis for disability for myositis. So I don't know why they didn't do that.
Okay. All right.
Did they put, I don't mean to ask what they said, but did they say another condition?
Yes, the medical adjudicator defined it as a malformed vascular deficiency, which means absolutely nothing.
No.
Vascular is veins.
Yeah, it has
Yeah.
absolutely nothing
No.
to do with it. I did
No,
get this,
there's
I was granted disability, but unfortunately the code is incorrect, so
Yeah.
that messes
No.
up everything else.
It won't, I mean, you'll still have disability, but again, I mean, I just worked on a disability case and I fought with a company to put the records straight.
Right.
Because I pulled up the disability code and said you're not using the right code on there, so
Right.
that annoys me, but yes. Yes,
Yeah, do you have, and what is any recourse when you're waiting for Medicare to turn you down so it can go to another insurance company? And it's past 60 days?
to another, what do you mean another insurance company? Do you mean you have two different insurance companies insuring you?
Yeah, I'm waiting for a piece of equipment.
Sounds like she's waiting possibly for a Medicare denial so they can
Yeah, that's what I'm waiting for.
bill it to the
It
second.
said it was 60 days to get the denial, and it's been over 90 days.
That,
So we should be able to get in touch with Medicare and get that denial from them. Okay? There's a way to get in touch with Medicare and get that denial for you. Okay?
Thank you.
If it goes into denial from Medicare, then it will go to the supplemental then?
If Medicare doesn't cover it, your secondary doesn't cover it. However, if it's not a supplemental and it's a different type of secondary, then it will cover it. So do you have a supplemental or is it another secondary insurance?
It's a secondary insurance that I'm waiting for a piece of equipment.
So that can be totally different than what happens
They said I
with
had to be denied by
Medicare to get it covered. So that's totally different when it comes to equipment. Yeah.
so we did something similar to that with a different therapy as an IVIG where Medicare has to deny it and then you bill the secondary insurance. But for us, we're able to get you don't have to wait till we get that denial because we get the authorization with the insurance.
I
Then you bill
had
back.
that, and he said, no, I have to
Yeah.
wait for Medicare.
Yes, ma'am.
Just to explain, the supplement to Medicare, we're not on Medicare yet, but you can't have it tied to Medicare, right? It has to be an extra insurance that you take out on the side from Medicare.
So so it's called like a Medigap policy. It's a Medicare Part. Typically, people get a Medicare Part F plan. So, and there are a whole list of them
And you
that you
don't
get.
want one tied to Medicare.
It is kind of tied to Medicare. So when you do that, you have to shop around. What happens is a lot of people are getting calls and being told to go. So if you're disabled, and in certain states, they're told that there are no other options. You have to go in a Medicare Advantage plan. That's not true. Okay. The other thing is that they're trying to get people to go into Advantage plans, and cost effectively, it's cheaper to go in it because the cost of Medicare plus the supplemental is expensive, and then plus the Part D plan. But you have to look at what your network is, and do you have access to everything you need? And so you have to weigh everything and see what the costs are, and look at that. But we have to see what those plan, and it's called Plan F under Medicare. The Plan Fs that you're going to look at, which really takes care of what your needs are. It'll cover you at 100% then. Yes.
So, is an Advantage plan different than a supplemental?
Yes, that's called, it's a Medicare HMO. It's a Plan C.
And does it combine them?
It combines your Medicare, and you don't need a Medicare Part D. It takes care of your drugs, and it takes care of everything. So all of your stuff is taken care of in one step. So your hospital, your hospital's taken care of, your doctors are taken care of, and your drugs are taken care of.
With the
But yeah, but it's an HMO kind of system. No, it's not. They can call it a PPO, but again, there's a select network of people within it, and it's becoming more restrictive.
The one I belong to covers outside providers, but I have to pay more. It's a little 50% of what they determine is the cost of it.
Yeah. Yes, sir.
I guess my first question would be is, where's your slide on how to get residency in Canada? Or 38 other developed...
Move to Vermont and go with Bernie.
Or 38 developed countries other than, our Gilead society right now. For those who watch Handmaid's Tale.
Oh, me too. That's scary.
So but my next question, which won't offend most people here, is that I'm just in the process of moving from an employer HMO to Medicare, and I'll get an Advantage plan. Unfortunately, I moved right at the same time, so I'm changing all my healthcare providers as well. So I found out, I'm in Oregon, there's 4 Advantage plans in my region, in my county in Oregon, that I could qualify for. But I'm having a heck of a time. First, I want the best rheumatologist for me, and I don't know which HMO will include them in their network. And I can't get that from the doc office. I've tried a couple different times, and since I'm not a patient, I'm very reluctant to share much of anything. And so do I just have to call each Advantage plan and ask if the doctors that I'm thinking about, I don't even have now, are in their HMO?
You may. They may also have, you may be able to even go online, and they may have a list of their providers online. But again, there's no guarantee that that provider will stay within that network. That's the problem. Again, you're starting out with how many providers will take Medicare, and then you're going to cut it with the Advantage plans.
It's just insane. It's inhumane what's going on in society. Just insane. And everyone just going along with it. Let's vote for Trump. Just nuts.
Yes.
I saw that you said we have to be our own best advocates. And how do we help our doctors advocate for us? I went through, we won a trip to Disneyland off a raffle. And so I said, well, I can't walk around Disneyland anymore. So I have 100% coverage under Anthem Blue Cross for DME. And so I asked my doctor that I've been going to for over a year for physical therapy to help me see if I could get a mobility device. So she wrote in her notes that I needed the scooter because I was going to Disneyland.
Oh.
If you can only get one also if you have to use it in your house. If you're only using it for outdoors, you can't get one.
And see,
Wow.
that's my issue with lumping us into the same category as everyone else and putting us all under the Medicare standards. I'm not like everyone else. I'm like everyone else in this room, you know, which is why I enjoy being here so much, but I'm not like everyone else. I don't need one for in the house because I've adapted my whole house to my particular needs. It's out and about in the rest of the world where I need the help. And I can't get anyone. I had a case manager when I was busy out with friends or something and I missed my phone call from my case manager. She closed my case, even though I called back. So my frustrations are that the world, like he says, the world is moving on without us being able to have a voice.
Disneyland will provide one for you, but you gotta get from the airplane to Disneyland.
And it's
I ended up buying
$85 a day.
Craigslist and got lucky, but it was money that I didn't need to spend if she had just been a little more aware of what to put in her doctor's notes. And of course, I wasn't allowed to read them before they got sent, or I certainly would have said, what are you writing that in there for? You know, I need you to write down that I can't walk long distances.
I actually correct my doctor's notes. So, I mean, I go to Mayo in Jacksonville and they put it on the portal and I read it and then I send messages that you're incorrect on the notes because that's in my record, and they just write whatever they want to write and they're putting down stuff that's absolutely not correct in my case, and I want it documented correctly. So again, but they take things literal. So, and I also say that patients need to complain. We don't complain enough. So when things are bothering us, we tend to keep it in and not want to complain about things, but doctors can't read our minds. So, so it's hard. Same thing when you're getting infusions. The nurse doesn't know what's going on until it may be, you know, you may be starting to have a reaction, but you don't want to complain about things. I know with me, I'm the worst. I don't take my own advice, so it's not until I'm crashing before I say something. So, but you've got to voice these things so you can have that conversation with your doctor about it. You know, I really needed this, that wouldn't get it covered by my insurance company, but instead of saying I needed it for, I mean, you would like to have those conversations with your doctor, but instead maybe saying, I'm having a hard time with mobility when I'm going outside for any travel, so I would like to get this type of device for travel, you know, and so instead of saying Disneyland, say something like that, more broad, so that they can put that for an insurance claim.
Well, the problem with that was they announced the winners of the raffle on television, and everybody, you know, in my doctor's office heard it on TV. So, you know, it wasn't any secret.
Yeah.
It just,
So,
we talked about the reason why.
yeah, and then you could have said something like, which you shouldn't have to, but maybe saying, you know, but overall, I mean, this would be helpful for Disneyland, but I really would need this for anytime I'm doing any kind of, you know.
Well, because this is
Yeah.
a progressive disease.
Exactly, progressive disease and any type of long distance walking or anything like that, I can't do this. So can you put in something for my insurance,
Right.
not for this trip, but for overall for my disease?
And then you've got to be careful what you want, because you can only get one every 5 years. So if you get a walker, you get one every 5 years. Then if you progress and you need the scooter for inside your house, you can ask for that. But then you need an electric wheelchair. Well, sorry, you got 3 more years to go.
Can the notes be corrected by the doctor?
Yes, it can. It can be amended.
That's what the job
I was gonna share one thing on, that I can relate to. We have a case going right now that Michelle's working on where the physician was prescribing a new therapy, and in its notes it said patient doing well on whatever it was. It's on his current therapy, so it said patient doing well on, however, the rest of the notes. Well, the insurance took that one line, and so well, if they're doing well on that, why do they need, why do they need this? And so Michelle had them, they're back at the clinic, and that note's being rewritten the way that, so the insurance can interpret it the way it's supposed to be interpreted.
Why would they say that in the first place?
Because it was a multi-diagnosis. So they wanted the treatment for another diagnosis, but again, it's treated for it. So those things happen. And sometimes also you may have multiple diagnoses, and a treatment may, your insurance may like the treatment for one diagnosis and not another. And so guidelines are preferable for one diagnosis and not another, and your doctor may write it for one. So oftentimes we'll go back to the doctor and say, I know you wrote it for this diagnosis, but this patient also has these other diagnoses, and the insurance company guidelines will say that the patient will get it covered for this other diagnosis. Can we go ahead and code it for this because the patient does have this? And then we go ahead. So those are things that you need to work as a team. And that's the goal, is working as a team with your doctor and you, and having good communication.
Don't they have advisors in the doctor's office to help with insurance?
No.
Some do, and some
Most don't.
really aren't good.
It's such a mess.
You gotta be your best advocate for yourself wherever. The manager told me they had no more toilet lifts, and I says, then you come up to my room when my spouse is asleep and you get me off the toilet twice during the night. He went out to a medical supply and bought me.
Yeah.
And this happened in Reno too. They didn't have enough to go around, and Reno says, too bad. So you gotta stick on everybody. Got to Tokyo with this, and I had luckily the papers with me to be my own advocate, because we were on our way to Bangkok to see my son's family, and they wanted to keep this in Tokyo because it didn't have the right batteries. No, it does have the right batteries, but you gotta carry all that stuff with you. Got stuck in Hawaii once with steel in my shoes. They stripped me and stuff. It was a red eye, and they did as fast as they could, and then they took 3 of us up in a cherry picker and brought us into a different side. But it was in Jamaica, and I had to go up this long stairs to get to the airplane. You have to ask so many questions and be such a good advocate for yourself. It's just, I'm so glad you're around. I'm so glad. And I'm glad for your hobby.
Are there other people like you in the industry?
Well, it's one of those things where I try to do as much as I can, and I'm sure there are other people out there that are willing to help. So, but when I say that you can call on me, you can. It's hard, once you start talking to me, it's hard to get rid of me, just so I can tell you. So, and I mean that. So it's a lifetime friendship. So, and I mean it when I say you do not, and I mean that very strongly, you do not have to be a patient of SiSi Pharmacy. If you go to our website, it says that on our website. Under advocacy, you do not have to be a patient. We don't want patients falling through the cracks. So we want to help, and we've made that commitment. So you ask away here, take my card. If you don't want to ask here, you have questions, you can call me, email me, and I will get back to you.
Well, just
Yes.
one thing you said that my husband is IBM. He's currently in a nursing home and will remain there, but so he's pretty far along with it. But what I found is that since Anyway, so what I found is he just states the facts and that's all. And he doesn't always even particularly get the innuendos. And so I have to just kind of beat it to death, and usually that'll help him. So I think if the spouse can also, if there is a spouse or another person, and I know what you're saying, that it is best if the person can advocate for themselves.
But sometimes you
But
can't.
they also get very tired.
Again, and sometimes when you're in the worst times,
Yes.
that's when you need somebody else to help you.
Right, I
And then
think so, too.
my hope is that when you're feeling better and you learn the process, then you're able to help others. And then we could all be advocates helping each other. And that's the best part of all this. But when you're really down and not understanding this and feel it's hopeless, don't. Because I'll be there to help you through this.
That's what I think. You know, they need somebody. Everybody needs somebody.
Exactly. Exactly. We all get through that times where it just feels like it's too much. But you just have to take it day by day. And we have bad days, and then we'll have good days. And we'll get through those. And things get overwhelming. But you've got to reach out to people who can help you through those overwhelming days. Okay? So I'm here through the rest of the conference, and then you've got my contact information. Great.
So did you say you have DM with
I don't. I have another, I know it's on there, but I have another autoimmune and connective tissue disease, so.
You still get it.
I get it. I'm a patient, so I understand what it's like to go through it.
Hooray for the group TMA. It's the Myositis Association, helping patients become peers now for the past 25 years. So if you have been diagnosed, here's an organization to unite us. 8,000 members they can boast. That real strange word that no one's heard, it's myositis. There's an annual patient conference which is just second to none, where you'll learn a lot and network, and you'll also have some fun. And their website is updated with a lot of current news, with lots of info and resources and much more that you can use, like info TMA compiles, and like lists of clinical trials and lists of research too. You can review because it's all there for you. So hooray for the group TMA. It's the Myositis Association, helping patients become peers now for the past 25 years. So if you have been diagnosed, here's an organization to unite us. A quarter century they can boast. They've been the group that's got the scoop on myositis.